Parkinson's disease. Parkinson's is a progressive disorder of the nervous system that affects movement. Parkinson's develops gradually, sometimes starting with a barely noticeable tremor in one hand. A tremor is most well-known sign of Parkinson's, but can also start with stiffness and slowing of movement. Parkinson's disease occurs when nerve cells, neurons, in the substantia niger die or become impaired. These cells produce a chemical messenger called dopamine, which transmits signals within the brain to produce smooth physical movements. If they are damaged or die, communication between the brain and muscle weaken. This leads to the brain eventually not being able to control movement. In many cases, Parkinson's disease occurs in people with no apparent family history. In family cases, the inheritance pattern depends on the altered gene. If the LRRK2 or SNCA gene is involved, the disorder is inherited in an autosomal dominant pattern, which is one copy of an altered gene in each cell is sufficient to cause the disorder. In most cases, an infected person has one parent with the condition. If the PARK2, PARK7, or PINK1 gene is involved, Parkinson's disease is inherited in an autosomal recessive pattern, which means there are two copies of the gene in the cell that are altered. Symptoms of Parkinson's. Number 1. Tremor has a characteristic appearance. Typically, the tremor is a rhythmic back and forth motion at a rate of 4 to 6 beats per minute. It may involve the thumb and forefinger and appear as a pin-rolling tremor. Tremor usually disappears during sleep or improves with intentional movement. It is usually the first symptom that causes people to seek medical attention. Rigidity is the resistance of movement. The muscles remain constantly tense and contracted so that the person aches or feels stiff. The rigidity becomes obvious when another person tries to move the individual's arm, which will only move in a ratchet-like or short, jerky movements. Bradykinesia is the slowness of movement. The slowing down of spontaneous and automatic movement is particularly frustrating because it may make simple tasks difficult. The person cannot rapidly perform routine movements. Posterior instability or impaired balance causes affected individuals to fall easily. A number of other symptoms can occur in people with Parkinson's disease: depression, emotional changes, difficulty with swallowing and chewing, speech changes, urinary problems or constipation, skin problems, sleep problems, dementia, muscle cramps, pain, fatigue, and sexual dysfunction. There are 5 known stages of Parkinson's disease. Stage 1. Symptoms on one side of the body only. Stage 2. Symptoms on both sides of the body, no impairment of balance. Stage 3. Balance impairment, mild to moderate disease, physically independent. Stage 4. Severe disability but still able to walk or stand unassisted. Stage 5. Wheelchair-bound or bedridden unless assisted. Early onset is when signs and symptoms occur before the age of 20. Late onset is when signs and symptoms occur after the age of 50. Treatment. There is currently no cure for Parkinson's. Medications and surgeries can often provide improvement in motor skills. Many different medications can be prescribed to help increase the level of dopamine in the brain. There is one surgery called deep brain stimulation, where electrodes are placed in a spot of the brain to reduce Parkinson's symptoms.